Thank you for watching. Have you ever suddenly had a leg cramp at night or early morning, causing so much pain you couldn't sleep? If this pain kept going, I feel like I'd lose my mind. That's how much it hurts, right? Actually, about 90% of people have experienced leg cramps, also known as Komura-gairi. And what's more, there are reports that leg cramps become more frequent as you get older. If you leave it untreated, you might not be able to sleep deeply, carry your fatigue into the next day, or have trouble concentrating at work. Leg cramps can actually have a surprisingly big impact, and actually behind these leg cramps, there could be a dangerous illness hiding. That can happen too, but don't worry. This time, from the perspective of a practicing doctor, I'll explain the causes of leg cramps and introduce simple stretching methods you can do on your own to relieve the discomfort of leg cramps. There is a lot of information floating around on YouTube and the internet, but I actually deal with patients who come to the clinic complaining about leg cramps. As a practicing doctor, I will share reliable information based on my actual clinical experience, so I would appreciate it if you could subscribe to the channel so you don't miss any new videos. Now, let me briefly explain why leg cramps occur. Then, I will talk about some unexpected causes of leg cramps. And finally, I will introduce some stretching methods to help improve them. So first, what exactly is a leg cramp? The word Komura refers to the calf. It's as if your calf has turned inside out. It's called Komura-gairi because of the intense pain, so leg cramps mostly occur in the calf. The pain is caused by the muscle suddenly and involuntarily contracting tightly. It's easy to understand if you think of the muscle going out of control on its own. Why do cramps happen so often in the calf? Actually, the legs are the farthest part from the heart. Because they're so far away, blood flow in the legs tends to stagnate and get blocked, which is also why swelling is common there. And because of gravity, it's very difficult for blood to return from the lowest part of the body back to the heart. The role of sending blood back to the heart against gravity is handled by the calf, which is also called the second heart. Here are the legs. Blood returns to the heart from them. Blood goes upward against gravity, but there are muscles around the blood vessels, and when these muscles contract tightly, they squeeze the blood vessels, pushing the blood upward. That's why the calves are called the second heart. So what happens then? For example, if your muscle mass decreases, you can't squeeze the blood vessels tightly, so blood flow in your legs tends to stagnate, causing fatigue substances to build up in your legs and making you more likely to get leg cramps. That's why it's important to maintain strong leg muscles to prevent cramps and swelling. Regular exercise is very important for that. By the way, the most common place to get cramps is the calves, but sometimes it happens even farther away, like in your toes or in your thigh muscles. We often see people like that in our outpatient clinic. Now, let me clearly explain 4 main causes of leg cramps. First of all, as a basic premise, the most common cause of leg cramps is physiological. Physiological means that it can happen to anyone who is alive. That's what it means. The muscles in our body receive signals from the brain, which travel through the spinal cord and are transmitted by nerves to the muscles, causing them to contract or relax. As we get older, this support system doesn't work as well, and the muscles contract on their own. In other words, the muscles start acting out of control. So most leg cramps don't have a specific cause, and even though they're painful, they just happen. It's really quite a nuisance, isn't it? However, there are also other things you should be careful about. There are 4 main causes that make you more likely to get leg cramps, so let me explain them. Here are the 4 main causes of leg cramps. The first one is dehydration. This might be well known, but have you all heard of the term hidden dehydration? Medically, there's no such condition, but whether we're exercising or not, we lose water from our bodies every day.
寝ている時も例外ではありません。寝ている間というのは水分補給ができないので、私たちはどんどん水分を失っていく一方で脱水になりやすいんです。
You might be able to prevent leg cramps. The second of the 4 main causes of leg cramps is an imbalance of minerals. Our bodies are regulated by a delicate balance of minerals such as sodium, calcium, potassium, and magnesium. When this mineral balance is disrupted, leg cramps are more likely to occur. For example, when you get heat illness, sodium and other minerals are lost through sweat. When you lose fluids, such as when you have gastroenteritis and vomit, or have diarrhea and lose a lot of fluids and minerals, leg cramps are also more likely to occur, especially sodium. So-called salt is important. Doctors often say that too much salt can cause high blood pressure, but actually, sodium is a very important component for maintaining the body's fluids when taken in the right amount. So being too careful and not taking any salt at all might actually disrupt your mineral balance. It can be a cause, so please make sure to take in an appropriate amount of salt to prevent dehydration. The third cause of leg cramps is blood sugar levels. This might be surprising, right? But it's easy to understand if you remember the reason. The nutrients we take in through our mouths become sugars in our blood. The blood sugar level provides energy throughout the body. So for example, if you have low blood sugar, your whole body becomes low on energy, and your muscles also lack energy, making it easier for your legs to cramp. But low blood sugar isn't the only issue. If left untreated, you could lose consciousness, or in the worst case, it could be life-threatening. So it's a very dangerous condition. If you feel like your legs are cramping, that could be an early symptom of low blood sugar. So if you suspect it, try to take in some sugar by eating candy or chocolate. Please keep that in mind. On the other hand, with diabetes, it's also said that leg cramps can easily occur if your blood sugar gets too high. That's pretty surprising, isn't it? So it's good to remember that both low blood sugar and high blood sugar can easily cause this. Now, here's the fourth surprising cause of leg cramps. It's anemia. You might not really associate a lack of blood with leg cramps, but the reason is actually simple. When you have anemia, it means that the oxygen we absorb from the air, you're lacking a substance called hemoglobin, which is responsible for carrying oxygen throughout your body. So when your body can't transport oxygen throughout, your whole body becomes low on oxygen. When your muscles are low on oxygen, you're more likely to get leg cramps. Women are more likely to become anemic even during a normal period, and both men and women can easily become anemic from losing blood due to things like hemorrhoids, if your leg cramps just won't go away. At times like that, it might be a good idea to check your blood sugar and see if you have anemia. Also, as you probably know, overusing your muscles can also cause leg cramps. Back in your school days, didn't you ever almost get a leg cramp after pushing yourself too hard in PE on a hot day? That's because when we exercise, our muscles start to break down. When muscles break down, a substance called creatine kinase, or CK for short, is released into the blood as the muscle tissue is destroyed, so muscle breakdown can also cause this. Leg cramps are more likely to happen, so you need to be careful about them at night after a day when you've exercised hard. As a precaution, on days when you've exercised hard, it's easy to get dehydrated or have an electrolyte imbalance, so make sure to properly replenish fluids and make sure to get enough salt before going to bed. Let's review what we've covered so far. The causes of leg cramps are often physiological and can happen to anyone, but a common cause is dehydration or an electrolyte imbalance. We also mentioned that low or high blood sugar levels and anemia can be causes. Now, let's move on to the fact that sometimes behind leg cramps, there may be an unexpected and dangerous underlying disease. I will introduce 3 such patterns, even after trying various measures. If your leg cramps don't get better, in such cases, what I'm about to introduce, there might be an underlying disease, so please use this as a reference. The first of the 3 diseases hidden behind leg cramps is arteriosclerosis of the legs. Our bodies have enough blood vessels to go around the earth 2.5 times. Are actually spread throughout. There are blood vessels so fine that you can't even see them. Especially in the legs, since they are the farthest from the heart, there are many thin blood vessels in the tips of the feet. When arteriosclerosis affects the legs, narrowing blood vessels due to damage or fat buildup, leg cramps become more likely. This is called peripheral artery disease, or PAD. There are common leg cramps and leg cramps caused by this arteriosclerosis. There are ways to tell them apart. Common leg cramps usually happen at night or early in the morning, but those caused by arteriosclerosis in the legs often occur during exercise in the daytime. It's easier to remember if you focus on the reason. As arteriosclerosis in the legs progresses, blood flow worsens. And when we're exercising, our muscles are moving actively, so they need more energy. In other words, blood flow is necessary. However, if you have arteriosclerosis, the blood flow is blocked and the necessary oxygen and nutrients can't be delivered, so the muscles don't get enough energy, which can cause cramping or pain. That's why cramps can happen not only at night, but also when you exercise. For those individuals, hardening of the arteries in the legs could be the reason. There's a video about it in the description, so check it out if interested. The second surprising disease that can be hidden behind leg cramps is this one, lumbar spinal canal stenosis. It sounds complicated because of all the kanji, but it's actually simple. It's a condition where the spine around your lower back narrows and gets compressed, causing symptoms. Is there anyone around you who says, my lower back hurts because of a hernia? Do you know anyone like that? A hernia is also related to the intervertebral discs between the bones of the spine. It's a condition where the cushion gets compressed, causing the nerves to be pinched. When the nerves are compressed like this, you can experience pain in your legs or leg cramps. Those kinds of symptoms can appear. There's also an easy way to distinguish this from common leg cramps. Leg cramps caused by pressure on the nerves in the spine often happen when you're standing up straight and moving around. The reason is that when you're standing up straight, your spine is aligned, and behind the spine, the nerves are more likely to get compressed. On the other hand, when you're leaning forward, like when riding a bicycle or pushing a shopping cart, your spine tilts forward instead of being straight, which often relieves the pressure on the nerves and makes the pain better. When you walk straight, your legs start to hurt or cramp, but if you sit down and rest, it gets better. If you have those symptoms, you might have lumbar spinal canal stenosis. The nerves in your lower back are being compressed and narrowed, which could be causing the cramps. The third dangerous disease hidden behind leg cramps is this one. It's medication. Strictly speaking, it's not a disease, but it's common for cramps to be caused by medication. Many patients don't realize that their medication could be causing their leg cramps. So if the doctor doesn't explain it properly, a lot of people won't bother telling their primary doctor that their legs cramp up at night. So for medications that commonly cause leg cramps as a side effect, when it comes to medication, I always make sure to explain it before prescribing anything. Some well-known medications that can make you more prone to leg cramps include those for high blood pressure, cholesterol-lowering drugs, diuretics that help you urinate, and painkillers, among others. You don't need to remember each medication individually. If your leg cramps don't get better, or if you started having leg cramps after beginning a new medication, please ask your primary doctor if the medicine could be the cause. And I think it's very important to have a primary doctor you can talk to about anything without hesitation. Let's review. Dangerous diseases that may cause leg cramps include arteriosclerosis of the legs and lumbar spinal canal stenosis, where nerves in the lower back are compressed. And finally, I mentioned that medications can also be a cause. In addition, there are also nerve and muscle diseases and liver cirrhosis. There are also various other dangerous causes such as kidney failure, hemodialysis, and cancer. Since leg cramps can be very painful, please don't ignore them. If you feel something is wrong, consider seeing a doctor. Now, finally, let me introduce the method you've all been waiting for to relieve the pain of leg cramps and help you sleep soundly through the night. It's this stretch right here. I don't think many people are this flexible, so if you can't reach your toes, try bending forward like this. There's an important point to keep in mind when you do this. Prepare a towel like this, loop it around your foot, and pull on the towel to stretch your calf. When you take this position, your calf will also, and the back of your thigh, called the hamstrings, will also be stretched along with your calf. There is data showing that stretching both your calf and the back of your thigh can help reduce the pain caused by leg cramps. This is a common stretching your leg, and doing a movement that stretches your Achilles tendon only stretches your calf. So just stretching your calf alone was not enough to reduce the pain from leg cramps. There is no data supporting that. So even before going to bed, make sure to stretch the back of your thigh and try doing exercises that stretch your calves as well. By the way, if your leg cramps aren't getting better and it's tough and painful when it happens, and you want to recover quickly, in those cases, medication may be prescribed at an outpatient clinic. A commonly used medicine is Shakuyaku Kanzodo, which is also available over the counter. There are many patients who say that taking this medicine made them feel better right away. Some people take it every night as a preventive measure because they get cramps every night. Some people experience this as well. If stretching and addressing different causes haven't helped, visit an outpatient clinic and consult a doctor. There may be an unexpected cause. Using medication might relieve your discomfort. Now, let's review. Leg cramps are caused by muscles contracting uncontrollably, which leads to pain. Common causes include physiological factors that can happen to anyone, as well as dehydration, mineral imbalance, low blood sugar, high blood sugar, and anemia. And as potentially dangerous underlying conditions, I mentioned arteriosclerosis of the leg arteries and lumbar spinal canal stenosis, which is a disease where the nerves in the lower back are compressed. And finally, I mentioned that medications are also a common cause. I introduced it that way to help relieve the discomfort of leg cramps. Stretching the calves and the back of the thighs can be effective. I introduced some stretches. Even just 5 minutes a day is fine, so please try them before you go to bed. At YouTube Yilo we explain why certain illnesses occur in a clear and enjoyable way. Focusing on the why makes it easier to remember and understand. When incorrect information comes your way, you'll think, isn't this wrong for these reasons? It helps you make such judgments. To make sure you don't miss any new videos, I'd be really happy if you could subscribe to the channel. Hospitals, by their very structure, are places where people go after they become ill. Hospitals earn medical fees and profits when patients come in, receive treatment, and recover. Even if hospitals provide education on prevention or early symptoms, it usually doesn't lead to profit. However, what's most important is the stage before disease develops. It's about detecting issues early before they develop into a disease, and reducing the risks that could lead to illness. From now on, I will continue to share important preventive medicine information from the perspective of a practicing physician, so I hope you will continue to support me and stay healthy. And in the comments section, please share your experiences, like, I had leg cramps but got better by doing this, or I went through something really tough. I'd love to hear about your experiences, so please let me know in the comments. Also, whether you give this video a thumbs up or a thumbs down, your feedback will help me improve future videos. And as I mentioned in this video, here is the video about arteriosclerosis in the legs, and here is the video about diabetes symptoms, which are hard to notice in the early stages. And here's the video about symptoms that occur when your kidneys get worse, which can easily cause an imbalance in minerals. This video will help you detect it early. If you're interested, please check it out from the description below. Well then, see you again in the next video.